at birth. Sex is not assigned at birth. Sex is established at conception, and it's recognized at birth, if not earlier. But to claim that sex is assigned at birth is without any scientific basis whatsoever.
Doctors dismantle gender ideology. Gender ideology has rapidly infiltrated our schools, medicine, and public policy, despite mounting evidence against its core claims. Watch as Dr. Grossman unapologetically cuts through the confusion, examining how this belief system contradicts established scientific research and biological reality. Dr. Merriman Grossman has never failed to defend truth and reality. This time, she felt compelled to speak out against what she sees as a dangerous departure from biological reality and sound medical practice.
First, I'm struck by her use of the phrase, sex assigned at birth. Sex is not assigned at birth. Sex is established at conception, and it's recognized at birth, if not earlier.
Dr. Merriman Grossman is a psychiatrist who specializes in child and adolescent mental health. She has long spoken about gender and what it fosters in medical practice. She exposes the failures of what some call gender-affirming care, pointing out that youth often get by with minimal mental health examination before transitioning socially or medically.
And especially when one of those many choices that we're providing to young people is to deny reality. So it's not just that we're providing them with too many choices. You know, like when you walk down the cereal aisle and there's like 200 different kinds of cereal and you get dizzy from it. That's not what we're talking about. We're talking about one of the options here is to actually deny reality.
Grossman highlights how this approach can lead to irreversible procedures and regret, especially in young individuals, without adequately addressing underlying psychological conditions like anxiety or autism.
Quote, the risks of anti-puberty and hormone treatment for those under 18 currently outweigh the possible benefits. The UK conducted a review and called the evidence very low.
Importantly, she also describes the effects on parents. Most parents naturally envision their children developing along typical paths, embracing their biological sex as part of their identity. When children express gender distress, parents often experience deep anxiety and confusion. This intensifies when faced with major medical decisions like hormone therapy, choices that can have lifelong implications. Dr. Grossman argues that parents are being placed in an impossible position, forced to choose between supporting their children and protecting them from what she views as potentially harmful medical interventions. She sees this as a crisis that disrupts the fundamental parent-child relationship and challenges traditional family dynamics.
You know, your daughter comes home and her voice has dropped and she's growing facial hair. That's traumatic. And when your son comes down the stairs to go to the prom wearing a dress and heels and makeup.
Grossman often speaks about parents who feel vilified for questioning these medical malpractices, emphasizing the struggle to protect their children from what she describes as harmful interventions. Grossman's passion stems from years of witnessing the suffering caused by these treatments, which she documents in her book, Lost in Transnation, A Child Psychiatrist's Guide Out of the Madness. Her book, Lost in Transnation, is dedicated to the parents she describes as heroes for challenging a deeply flawed system. Grossman encourages parents to educate themselves, seek alternative opinions, and advocate fiercely for their children's mental health needs.
It's disenfranchised. And as you know, disenfranchised grief, complicated grief, is much more difficult to live with, to deal with, and to heal with. So when you have a terrible loss and grief, and you can't even share it with people at work, or maybe even your own family, and maybe your other children are endorsing the unreality and are using the new name and pronouns. Maybe even your spouse is. And so some of these parents are living with such deep loneliness.
Her advocacy underscores the need for a more cautious and evidence-based approach to gender dysphoria, prioritizing mental health exploration over immediate medical interventions. Grossman's critique has made her prominent in discussions around the ethics and implications of gender-related medical practices.
Kids are being led to believe, and parents are being led to believe, that you can step in with these very powerful medications, these hormones, and you can deny biology, and you can pause biology, and you can create
You
can create a persona of the opposite sex without paying a huge price. That is the lie that's being told, that you're not going to pay a price for this.
In her view, the affirmation model disregards the complex and evolving nature of identity formation during adolescence. For example, she points to studies showing that a significant percentage of children with gender dysphoria desist from these feelings after puberty, if allowed to explore their identity without intervention. She openly expressed her views against Dr. McNamara's claims during a U.S. House committee. After introducing herself as a certified child, adolescent, and adult psychiatrist to cement the importance of her views, she went on to destroy gender ideology.
By her use of the phrase, sex assigned at birth. Sex is not assigned at birth. Sex is established at conception, and it's recognized at birth, if not earlier. Dr. McNamara claims that her views are science-based, but to claim that sex is assigned at birth is without any scientific basis whatsoever. Its language misleads people, especially children, into thinking that male and female are arbitrary designations and can change. That is simply not true.
Moreover, she claimed that the demands of gender ideology supporters were entirely false and unjustified. Dr. McNamara had said in favor of gender ideology that scientific and medical interventions are the only evidence-based treatment. She stated that according to scientific evidence, it is life-saving. Dr. Grossman narrated Dr. McNamara's threat sarcastically that without gender-based medical treatment, kids will commit suicide. Then Dr. Grossman gave her views with startling facts and figures that refute this statement.
Well, a growing number of countries have effectively banned the care to which she's referring. And thank God there's been no wave of suicides or other mental health catastrophes.
Grossman is particularly critical of the affirmation-only model, which he believes prioritizes immediate social and medical affirmation of a transgender identity over careful evaluation. This model, often supported by medical institutions such as the American Academy of Pediatrics, includes steps like social transition, puberty blockers, cross-sex hormones, and sometimes irreversible surgeries. Grossman asserts that these interventions are frequently recommended without fully addressing potential underlying issues, such as trauma, anxiety, depression, or neurodevelopmental disorders. She listed out countries and their safety measures against this gender ideology after several cases went wrong. She highlighted that Dr. McNamara's claims were entirely wrong.
3 years ago, Finland placed strict limitations on medical interventions for minors. Sweden did the same thing after a 14-year-old girl was found to have osteoporosis and spinal fractures from puberty blockers. They've also placed severe restrictions on the care that Dr. McNamara calls life-saving. Norway also analyzed the data and has made similar changes in policy.
Infuriated by the naive approach, Dr. Grossman states that these concepts were incomplete and devoid of any workable proof. She expands the issue of gender ideology onto the broader horizon of cultural and ideological transformation. She claims that the emphasis on providing legitimacy to the subjective identity of a human being at the cost of biological realities marks a sharp departure from scientific rigor. She shares exactly the same view as broader critical voices that believe gender ideology breaches the core pillars of biology, ethics, and medicine. She named a few people: Kenneth Zucker, Paul McHugh, and James Cantor, who never supported gender ideology. They engaged with transgender patients for several years and thus became familiar with the common victims of gender ideology.
What she doesn't want you to know is that there is no standard. There's a debate. There's a fierce debate. And on the side opposite her stand such prominent figures as Stephen Levine, Kenneth Zucker, Paul McHugh, and James Cantor, among others. These doctors are giants in the field. They have been treating transgender patients and gathering data and publishing papers about them, and I mean no disrespect here, but since before Dr. McNamara.
One phenomenon Grossman highlights is rapid onset gender dysphoria, a term used to describe cases where adolescents, particularly teenage girls, suddenly express feelings of gender incongruence without any prior history of dysphoria. This trend, she argues, is influenced by social contagion, peer dynamics, and exposure to online content that promotes transitioning as a solution to a range of personal struggles. Grossman has raised concerns about how quickly these individuals are often placed on a medical pathway, bypassing careful psychological evaluation.
This is a social contagion. It's fueled by social media. Lisa Lippman described it. I'm sure that you've had other people probably discuss that. But so I did a few Zooms with the parents, 50, 60 parents. And I did it as much for them as for myself, honestly. I really felt that I needed to say a few things to them. And the gist of what I told them was I wanted to acknowledge the horrific ordeal that they're going through.
Grossman has never been a stranger to attacking major medical organizations, which he believes have been captured by activist agendas. She criticizes groups such as the American Academy of Pediatrics for failing to provide a balanced view on gender dysphoria. She argues that dissenting voices have been suppressed within the field, with few colleagues who do not feel afraid to speak out, fearing professional repercussions.
The point is that those veteran clinicians and others who have wisdom and experience are ignored because they disagree with the current narrative. They're against medical interventions for the same reason those 7 countries are. There is no evidence of long-term benefit, but there is evidence of harm.
While talking about the monster, Dr. Money, Grossman got critical of how Money had fabricated a whole lie to solve a tragic story. A boy named Bruce had got burned while getting circumcised. His parents were worried, so they noted Dr. Money's statement on television. Dr. Grossman narrates it as such.
In this interview on television, said that a boy can be raised as a girl and a girl can be raised as a boy if it's caught, if it's done early enough. And that early enough means before the age of 2.5 or 3. And the parents, the Reamer parents, immediately took note of that, and they thought, here's the answer.
Then, later, Dr. Money lied to Bruce's parents, giving rise to gender theory. Hence, the whole theory is actually based on a lie.
And John Money says, well, we have an answer for you. Because male and female is actually not related to chromosomes. It's not related to hormones. It's not innate. We can take little Bruce and we have to do some surgery on Bruce. We have to castrate him and we'll remove his testicles. He already didn't have a penis. We're going to remove his testicles. We're going to fashion, some sort of elementary sort of female genitalia. You're going to give him a girl's name and you're going to put him in pink dresses and give him dolls and raise him as a girl.
In context, Dr. Grossman explains that the biological markers of gender chromosomes are immutable and cannot be entirely altered by medical interventions. While hormone therapy and surgery can change external appearances, they cannot rewire the chromosomal or genetic underpinnings of sex, underscoring the limits of transitioning from one sex to another.
I mean, it's ridiculous. We have too much information about the impact of the chromosomes prenatally and the impact of hormones. So we know now that male and female, it's not only different genitalia, not only what John Money pointed out, lactating and menstruating. We have each cell in our bodies, except for cells that don't have a nucleus, which are very few. But every cell that has a nucleus is stamped male or female, and it makes a difference.
Right. This takes us to the Reimer twins. This tragic story of the Reimer twins is stark, highlighting the dangers of thrusting a gender ideology on people without any scientific backing. Dr. Grossman shares how David Reimer was biologically a boy, but when he was an infant, something went amiss during circumcision. Doctors even recommended that he be brought up as a girl under the observation of psychologist Dr. John Money. What endured ultimately with the Reimer twins was heartbreaking and horrific. David Reimer was made to undergo social conditioning, was dressed in dresses, and played feminine games, but never identified as a female. He developed acute psychiatric disturbance and was finally given his biological information about his sex in his teens. After Reimer retransitioned to male, he spoke at great length about his betrayal and trauma. Sadly, both Reimer and his twin brother later ended their own lives by suicide, which underscores the deep emotional scars of this experiment.
He committed suicide, and his twin brother died of an opiate overdose. Before him, his twin died first. The entire family was, what kind of words? Traumatized. It's not enough. Trauma is not enough to describe what that family went through.
My parents didn't know a lot that was going on. And if they would have known, it never would have happened. By me not saying anything, the medical community was under the impression that my case was a success story. And I was shocked when I heard that people thought that my case was a success story.
The truth remains, gender-affirming medical interventions such as hormone therapy and surgeries can have significant, irreversible side effects. Puberty blockers, for instance, halt natural sexual development, potentially causing long-term issues like decreased bone density, infertility, and disrupted brain maturation. When combined with cross-sex hormones, they often result in permanent sterility. Jordan Peterson summarized it this way.
No.
You mean like a whole missing forearm, for example, and a penis that doesn't work, and sterility and lowered voice and decreased bone density and the increased probability of the development of cancer and no evidence whatsoever that there's any mental health benefit, and all the trauma that you put your family through and all the regret that's going to emerge later in life when you find out that you're sterile, no ability to breastfeed, and complete loss of erotic sensation in the nipples, and et cetera, et cetera. You mean those risks, those trivial, by the wayside risks that are completely ignorable given all the euphoria you're going to experience when you put yourself in the hands of liars and butchers? You mean that story?
Okay, so this is what parents don't know that they must understand.
If you enjoy watching public figures rip apart woke culture, definitely check out Ben Shapiro's commentary and our most recent video. And don't forget to share your thoughts on Dr. Grossman's perspective in the comments below.